So I'm here back here with Chair Yamane. Chair, in addition to your professional career as a social worker, your volunteer work with the Medical Reserve Corps and the American Red Cross, you are taking on a quote, old new role as chair of the Health, Human Services and Homelessness Committee in the House. It's a big job. Can you tell us what some of your top priorities are in addition to public health that you'll be focusing in on as chair of Health and Human Services and Homelessness?
Sure. Yeah. Thank you, Della. So, first I would like to, thank everyone and leadership that, the committee has been combined. So we're actually doing health, human services, and the homeless issue. So what we're addressing is the safety net. And so one of the great things by combining it is the ability to bring in the whole sector, the whole safety net in to discuss the services that we have to address. Our biggest concern right now going into this session is addressing the financial shortfall. With the $1.4 billion budget deficit, we are looking at ways of, restricting what government services we provide, and that will impact everyone, including the services out there. And so, we are concerned because during these economic downturns, we see more need out there, right? So we have more people struggling. We want to make sure that every child and family is fed, that families have appropriate health care and coverage. And so there's a greater need that, we as the government, state want to help assist with, but also we're dealing with a huge budget shortfall. So one of the biggest priorities now are we're going through the budget line by line, special fund and operations, and looking at where can we find ways of enhancing what we do to help people and ways of reducing the services for cost efficiencies. And that's been, one of the things where we are looking at both departments, both the Department of Human Services and the Department of Health. So that's been great in the sense that I'm back in health, working with many of the partners I worked with years ago. But it's also refreshing to work with new partners and actually then requiring them to work together. So the vision then is getting through this fiscal time together, right? Neighbors helping neighbors, providers helping providers, and we're going to get through this. It's just that we might have to be a little leaner as we go.
And I think that's really going to be a theme throughout the session for all of our chairs. But for you, it's really important because, like, as you started off your comments, the Health and Human Services is the safety net for the state of Hawaii. So, I know that it's in good hands, and that you're going to be looking at it very strategically. So in addition to the safety net issues, there's always other issues of medical marijuana, vaping. We will remain focused on public health, but those issues will also come up. So do you want to talk a little bit about those issues?
Sure. So, as a chair and working with the majority leader, who was also the former health chair, we are also, looking at what is affecting our community. So we're actually going to be addressing a wide breadth of issues. For example, we're going to be looking at our emergency medical service system, our ambulance system. Is the state and the county relationship the best and most efficient? So we're looking at changing that. We're also looking at the way we deal with direct hospitals, state hospitals, and triage of services. So actually, we're working with Deputy Director Mercero on looking at a way of triaging and helping those that are having substance abuse issues and chronic mental health. So that way they don't clog our emergency rooms and our hospitals, but that they get triaged immediately to get to the right place for the right care. We're also looking at things like our medical marijuana system, and addressing the concerns about vaping. We're looking at our rural communities. Our neighbor island neighbors and residents face a huge challenge sometimes because they're quite far from the nearest healthcare provider. And so we're actually looking at ways of enhancing and strengthening telehealth so that way they can get access to this care right at home. We're also looking at making sure that our Medicaid population has the services because they're at the most risk. And regarding homeless programs, we are trying to ensure that the programs that are currently out there servicing our community continue even during this downturn. So we're trying to make sure that those are in the budget. We're also looking at ways in which we can work together, both state as well with our federal partners, to see if we can enhance some of these opportunities to make the most per dollar. We've been talking to Kapuna, we're talking to our Kiki, and we want to assure everybody that we are doing our very best to make sure that the services that is needed for them will be around. And so, to rest assured that we as the majority caucus is working very diligently on coming up with bills and packages that keep the focus on the children and our families and our communities as the number one priority as we move forward too.
I feel very confident, Chair, that the Health and Human Services and Homelessness Committee is in good hands. I want to give you just 20 seconds to wrap up this discussion. Your thoughts on the connection between public health generally and economic recovery.
Sure, it's key. Our economy is tourism, military, and it's based on people. And how do we ensure that services are done well is to ensure and invest in our people. So this COVID pandemic affected families, it affected mental health, it affected our children, how we even do schooling. And so this has permeated through every aspects of our lives. And so I want you to, you out there to know is that we are making sure that the services in the state will encompass all the services to make people feel better and supported as they go through this.
Thank you so much, Chair Yamane, for joining us. I know that we're heading in a good direction.